Hi, this is Dr. Min. Today we're going to talk about multiple sclerosis, acupuncture, and herbal therapy. To treat the multiple sclerosis, we have to know the fact sheet. Okay, what is multiple sclerosis about? Now I'm gonna call multiple sclerosis MS. MS is an autoimmune disease that affects central nervous system. So let's look at the picture here. So the whole multiple sclerosis are the damage of the myelin sheet. There's a sheet that wrap the nerves, just like the wires outside layers. When this sheet damage, the conductivity of the nerve becomes slower, so there become muscle weakness appears. So MS mainly happens in between age 20 to 40, but it can happen at any age. It affects 2.5 million people around the world. Every week there'll be 200 new patients diagnosed on Earth with multiple sclerosis. The ratio between women and men of the MS is 2-1. So whenever there's 3 patients, there's 2 women patient and 1 male patient. So in my clinic, we often see more of the women patient. The really diagnose of it, they need an MRI to really diagnose the MS to find out the deficit in the myelin sheet. But the symptoms are the fatigue, vision problems, numbness, tingling, muscle spasms, stiffness and weaknesses, mobility problem, pain, and problem of thinking, learning, and planning, depression, and anxiety. But in my clinic, most of patients come to see me with some muscle weaknesses and numbness and tingling. That's the main reason they come to see me. So now we know the fact of multiple sclerosis, then we need to design a treatment with acupuncture and herbs to around that fact. Number 1, since the demyelination started from the brain, and affect mainly the motor nerves, so I will usually use opposite motor center, 1, 2, 3 needles there to really make the motor nerve conductivity better. And also, I stimulate the affected areas of the leg and arms with electric stimulation. More often I use large intestine 10 and 4, pericardial cyst, this for the heart, 3 yellows for the hormones, stomach 36, spleen 6, and liver 3. And more often I use 妇科 and 环草. This can apply to both men and women to balance the hormones. Yeah, since the mechanism of MS is demyelination, so we need to improve the brain and the nervous system blood circulation, regenerate myelin, and clean up the toxins. So 补阳还五汤, this original design for the stroke patient, but I find it's very helpful to improve the brain and the nervous system circulations. So I use this is my primary herb. The secondary is 五子衍宗丸. This herb primarily designed to treat the male infertilities, but I found this help the patient to improve their muscle strength a great deal. I'm thinking this just like a stem cells alike to help the regenerate myelin, but we need a scientific proof on that. Yin Qiao San clear up the toxins. Our mouth just like a guard for a system. Always all the germs come into the mouth, but we need to clear that up. The best herb formula for that is a Yin Qiao San. These three patterns of herbs will be modified according to the pattern presented at patient's sublingual. So according to the sublingual, we're modified accordingly. The other part of the treatment is, each time when a patient comes to see me, I tell them we are here to build a team. It's not a you and me anymore. It's a team to win the victory over the disease. So my job is to use acupuncture and herbs to treat and fight against the disease. Patient's job is to do their homeworks. Homework, the number one is leg, wrist, and ankle exercise to assist the liver and kidney to eliminate the toxin in the body. So if you don't know how to do that, I explained that in my other videos already. It's on the plantar fasciitis. You can go review that to get the idea of it. The other very important thing for the MS patient is rest whenever tired. So for MS patient, most of the providers encourage them to exercise, but to me, I find out rest is very important too. If the patient is tired, they go over exercise excessively, it could cause more injuries, and it could cause more accumulation of toxins in your system. Excessive exercise can be harmful to the MS patient. I only advise them to exercise whenever they're energized. So for MS, there are always the curvatures when they feel tired. There's always curvatures when they feel energetic. When they go up, curvature up, energetic, go exercise, walking, running, whatever they can do. Go ahead and do it. That will conclude our today's presentation on MS. If you have any questions, please visit our website or call our phone numbers listed on the screen. Thank you very much. We'll see you next time.